Humal sa Rogul Mlay. Bodom ura meeting rin al itasils. Ilang yung November 6, 2023, 8 o'clock. Sa satellite office ra Oreor. Itiyang Olvira Lulaw joint meeting. Lobanggel Healthcare Fund, Medical Referral Committee. Kadamamul. Makote introduce sa rugul ad mo takaming lo sa turatang artya madilungil kumul mangartya lang tangakal al president ra Senate el Hokons Paules direkal ngartya nga vice president ra Senate el tangakal Senator Mariur direkal ngartya al itasil sa tangakal floor leader ra Senate el Cecilil Aldabel el nga tele Klisiek. Tinakang niya tangkal Senator Rugubay Inabol, Senator Chairman Awis and Means. Niya Senator Talams, arbitra Vice President. Niya tangkal Senator Umi Sangbaw. Senator Tabluan, Vice Chairman ng Committee Rahel. Senator Kasugi Tapsungino. Senator Ramangsaw, Senator Mark Rudim el nga left side. Awera ka kulidita yung ulmora chairman ra House, mga sura Senator sa Brasil may. Mga Senator Quartet chairman ra Committee ra Health and Social Welfare. Begitu mong mataramay yun mem sa also pa email so
just sulang Chair Dr. Quarte malungil litas swelb luaise edibok syokay kurtir karrokuil tirakul delegate sel no sab illo talor gidrel al titaswel ba ang niya atangak speaker sa Pino Anastasio tirakal no sab el amoy tamal betol el sungule le bang kamamarel al swel ba tirakal nga niya vice chair ngiraiwet el tirakal bang kamam esol el vice president vice speaker House of Delegate tirakal mem kumuur seguran may mga niya delegate sinsakal talor senators ng Arcel Telyang, madirek al delegate Rangat Pang, al tangak al Otob, madirek al delegate Ringiwal, Arurang, madirek al delegate Ramal Kayo, al Talay, o mamarino komeng, oise, musube se Tobi, tangak al delegate Ra Tobe, al delegate Marino, tangak al delegate Ra Imelig, al Umetaro, atangak delegate ra Balilio el Solablay, material atangak delegate ra Sonsorol, Kibons, eso lang material Ma'am Ngarte, ang niya vice chair ra committee ra health, el delegate ngayaw ra Akulibert, engal ngarbitar nga atangak chairman ra Ma'am Rawis and Means el delegate Orio alul ka. Sige chair ra committee.
Ikaw ata.
O nga ka delegate Ray, el chair ra committee ra health ra House of Delegate. Nilat kakanay.
Sulang possibile chairman yano kulidia microphone le kom kuk introduce ra healthcare fund el masul merel al itasil.
Malungil itaswal be chairman edibok tunga susunod kalkot mura Senate President Baules marukul senators maatngak kal speaker House of Delegates Anastasio marukul senators marukul delegates ti orang asulil malam saul talteal invite kama mem kutuk kaswes kat adu gila at ko dom taswarngi bakmutal te ale ako te bak introduce ra our members ra Healthcare Governing Committee. Nga rakli si Ekrelang gigida chairman at nga kal Dr. Yano. Nga governor ang Aramlungu State at nga kal Governor Van. Agit le Director of Finance ang nga agil ringil. Tirigigida ang artyang. Kukungwate al since katukurati nga healthcare fund kungwate al dik introduce ra Chief Financial Officer Social Security nga LCA kaya madirect le manager healthcare fund nga agitang nga direct nga rarbay na kultur ka Medical Referral Committee sab elect introducer tir direct manggil wal ko ra Madam Chair Secretary Committee Dr. Myra Adelbay members nga rin niya direct Dr. Dever madirect Dr. Besrak I know one member at nakal Minister Kafar Orbalao unfortunately mo takal sa Elmay dokumdas yung of Island so tirigay kiti etchera a members of presenter tel matamar ilang ka makamitir ka mar other all bill mga usubes nga ka administrator of Social Security may healthcare fund kambam sumula na te ala
Sulang era ada bodo mur lo treka agenda git di kungate al sa takasam lo ko president speaker ya medik sodia selne ulel ul magdakal diber tial ela ang edel sandera amla memong ya president of republic ul magdong mang chairman kanay ma chairman magur ma chairman inabo agim dila kalmor office sa president el nomes raw el naitol girela renovation ra selvidar smel nga Honolulu mang leutur seguide mo multiple wasabor nga telame gibo mitra healthcare fund selemel bol mitabor le minister hildam le of islander sel time so sel meeting healthcare fund al amlongira Thursday 2 weeks ago and dimlonia conflict teleng upnania confirmation hearing ra elway ikedartya makmunil wase tirgal terung amlo sub ilmora meeting tiagida ora mlehensi ra healthcare fund al may gingilul ala mo sa yel comment this after segida committee mer kita am legol ra wase also elect mitra healthcare fund magi mlo adadu akumdas we chairman yano ko ma chairman Adelbay en global goal albornia general knowledge ra rogulat ma igel ko ra issues surrounding ra medical referral law the starting il member de madum e by both address ulmati del meeting agiblem arrange ni makmeng asuli ra rogul senators mar house of delegates of ilme makada conducted tel meeting may bawa mo di altira ka sel agenda gid hindi ka uling ito makpalti dilungil chairman Adelbay el Balbo Healthcare Fund ilang akumda simulan niya meeting at member house sa Ilmong sa Ilmong bayil ko maskita overview healthcare fund emer ko bang ito dolmol marachanda madilungil chairman yano Dr. Yano also tiga ko na isra presence ra Dr. Mokol so ele matumtiya taringan level side Dr. Mokol ma kuidi olgi mo lekong chairman yano
Sulang Senator Corte Chair those who are beklad no civil mertian meeting President of Senate Budungli netara meeting dum lartiam segi dia Greg Ngirmang adirg minister Greg Ngirmang adirg minister ahel dum laringa hearing retial of interior senators girela Augrur Manila Abriur say etya ang laringa hearing lara Belang National Hospital lumra ringi sa lidrasyo wearable sering laringa hearing lo interior adrahel Sige del time ang kale Minister Rahel direct limlegrek. Tia teal magi maldi meranga suliu el metolor tial hearing o ay siger lo kui lo la HCF e direct dong ok le tangaringa agitangan ruta aurora bekulsils bolsebel longer angidil ger somiu longer the summary at Telehealth Care Fund double approving year April 2010 lower following year. What you say? Mera 2010 nga ulmul amle sign abol okay le sign ra May 2010 selala mo 2 quarters real ra April ra 2011 say gidel time la arilia committee member Chamber of Commerce representative governors martul ministers manggagidel SSA administrator segidra padorol me elang namo 12 years lorora HCF namo ringa building ngaringa officer HCF emerko ngaringa total program services along Masera Belao National Hospital direct along Masera Arsmer Sel Tobadre Belao Madi iswadal mo matakliak mong ngaringa report liya amis kitang lekor gumiu mong girel ngara madamiu rogui etiagidi a summary ra sera lomo utial program al mer elang mandal sal sogal mo masadringil ko maka chairperson chair by the Dorenga Suliu merko gi kaltmok elmo henjero ko questions kung asumi loger
Sulang Chairman Dr. Yano, Dr. Karseligang el Sebel Ngutial Lolgion sa Chairwoman Adelbaira Medical Referral Committee. Madibol Beskit Sel Koraway al Puk Losingil Girela Medical Referral Committee o REREL. Direct Kolkoramo Osmodi General Function in Relation and Morsel MOU Referral Transfer Aurol Legong. El Beskit Astaru Sersel Tripler Army Medical Center Losing Ngargere Tamanit Seringen. How does it work? Okay,
thank you so much. Maybe I'll start with just a brief background also for maybe in case anyone may not know the full like the members, for example. So I know it was mentioned that we do have 2 non-voting members. But for us, we have myself, Dr. Yuri, Dr. Dever, and then we also have Dr. Isa Mokol and Dr. Kapilian. We're all voting members there. So we do meet every Monday, whether it be in person or we've done virtual meetings in the past during COVID when we were not able to do in person. And we do reviews of referral cases that's presented through us for medical referral. So again, just to go over another background is, so we have 5 appointing physicians who are practicing in Palau. Each committee member is usually appointed for a term of 3 years, and 5 members, we are the only voting members. We do base our referral decision on the following is like whether we base it on the patient's condition, life expectancy, whether or not the condition can be adequately treated in Palau, or and the likelihood of the patient's condition, the likelihood of substantial improvement. For example, patient with a condition that the MRC determines is terminal, we may do further discussions with the referring physicians. And I think another benefit that we do get is when physicians do present their cases with us, you have senior physicians on island, and it's in our heart. We really want to try and help as much as we can. So just a bit of that background. So the primary role, I would say, is to provide the medical aspect or the advice in terms of the decision, the evaluating the case and its for approval for referral. We can also provide general advice to physician when they do come to us. If it's a case that may not be stable enough, for example, to go off island, then we may also discuss the case as physicians and provide sort of interventions that we can perhaps offer on island, or even offer a suggestion to do discussions through telehealth. So I guess that's pretty much the function. So we're just in Tripler, thank you. So in terms of Tripler, we haven't had any referrals to Mora Tripler through the website. This has been since December. Yeah, December, because I saw we haven't had any referrals since December, and it's because we, at the present time, we don't have that access. But we did receive communication through our partners at Healthcare Fund that they are creating a new access through a telehealth website. So we've all been invited to submit physicians for that. So most of us have already submitted our name, contacts, including credentials, because at this time I understand it's under review, but we haven't had any referrals since then.
Detail management Trooper Army Medical Center ang healthcare fund ang medical referral.
It's healthcare fund ever since I think 2018.
2018.
Yeah.
Al sabele Dr. Dever. Pas kaulgiul mal dim mukar update ramam ra sel beginning ra tagi del Trooper Army Medical Center bebi ramam ma tagi sal madagali. Kamla ra ulel.
Well, as Dr. Yano will remember, as Dr. Yano will remember, the communication initially with Tripler really began in the late 1990s. And Dr. Yano was actually one of the vanguards of that communication, either by fax or email. With regards to the referral of patients. We had developed a very good relationship with Dr. Person, who was a pediatric rheumatologist at Triple Army Medical Center. And with him and his administrative telehealth staff at the time, we were able to develop a protocol for using store and forward internet referral for Tripler Army Medical Center. And it really was a very productive activity over the years, saving the Ministry of Health millions of dollars. We would sometimes refer up to, on normal years, at least 45 patients a year to Triple Army Medical Center at a cost of savings of over almost $3 million. There were times, for some reason, that traffic would slow down for the rest of the region, and Palau would have 50%, more than 50% of the referrals. You know, understanding that Palau is 4% of the population of the U.S. Associated Pacific Islands, Palau was pulling down over 50% of the referrals to Triple Army Medical Center. So it just showed that how tuned up the physicians in Palau were and how they knew how to use the internet store and forward process. Well, the triplet in recent years, say the last decade, interactions with Tripler have gone up and down depending upon the funding through the United States government and the U.S. Department of Defense. But still, Tripler has I think, the appetite, particularly to come to Palau, because Palau has been so interactive with them over the years. The complaint I would routinely receive from the Triple Army Hospital Administration was when they would try to communicate with the other jurisdictions, it was like nobody was home. Palau would respond, and it was to our benefit. And it's really the doctors in Palau, along with the administration, that supported that whole activity. So at any rate now, we've been in a pause while Tripler reestablishes and develops a newer telehealth platform. And so I am sure that within a short period of time, we will be again referring a broad range of patients to Tripler. One of the benefits has been that Tripler would choose Palau for its humanitarian visits of the physicians and teams from Triple Army Medical Center. And we would fund them through various processes, whether it be a grant that we captured. For example, there's the Universal Newborn Hearing and Screening Grant, in which over the years we have, Palau has benefited with probably several $1 million in funds. And the physicians at Tripler helped us write the grant. And two, we have been able to fund ENT teams, ear, nose, and throat teams, for 15 years or so from Triple Army Medical Center, and still are funding them. The good thing is when these various teams come, there's ENT, there's adult cardiology, there was in the past pediatric cardiology, and then urology, dealing with problems of the kidneys and such. The good thing was they would identify patients locally that needed further services that only Tripler could provide for us. So we would put them on the website, and they were almost automatically accepted by the Pacific Island Healthcare Program at Tripler. So Palau benefited in many ways, and I think will benefit into the future. I'm not sure that's what you wanted, Mr. Chairman, but I'd be glad to answer any questions. And Dr. Yano could add to this, really.
So long, Chair. Dr. Dever, remember the first, I will speak English to you and then speak Palau to the...
Mama Saud.
The telehealth program actually started in Pacific Basin Medical Association meeting in Ponape, year 2000. So at that time, Dr. Person was in Ponape, and we were able to connect and talk to a specialist who is a kidney specialist in Hawaii regarding a patient in Palau. And so that's was the power of distance consultation. It was limited by the internet bandwidth. And at that time, you could only send email and attachment. And that's the reason why he's talking about store and forward. O say, Dever? Okay. Ilang awak mo smodin marar senators. Kal Dr. Dever amle trau ulit arwala Dr. Mogol la tovdra school. Tilovdra school Pacific Basin Medical Officers Training Rabalabi. Segi del time amle suadlo mesak mutirgal الملاتوب البأس المجرل توقتان مقرادو الدغرتير رأم سوبير مع سيرفيس المرا بلورير لوجي و أبأس التلتلة لدو مقرر سمير السوكم موديادو دنيك متيان مرال السير ان سبيد لوجيرا سبيشاليست را تريبلر سيام لو كذا سبورت ترجال باسم جغريل توقتان يا دكتور بسرق مملتارتير مولمور سيجد التايم يا بول following year tingilak lakdal tingila computer ma igal camera ma microscope ma omesadingat ma scanner المسكدرة Ministry of Health من سل بورنيا إشورا من كذا مدورة تال سبيشاليست كذا ما إكس-راي ما سياسين يدورق المورتير تيرا أو سبيل تيجي البلاتفورم اللي مقدرين store and forward ندير لايف من سبيلا توقتان الممضيق مغاريا كيس mo sa case mesa igal siya sing ermula comment kamama kumam dingiruri say abulgulak mo store and forward hindi live le internet rigid letter give lang songs mergon at cloud to tler tial tripler at tiang trainer at basel toktang gigre toktang almora US military among tospe a case derlo sub the case among namode a case ra Hawaii len toka guru ra Hawaii metilgang amorang od hospital digel case ra Micronesia amle togubets len maklo hebreo complicated lesorir tirgagil toktang lomes mesel labong al sugum ngkal patient asbel ngarnya relil girel subir ar toktang et acceptra case al acceptra case et tahara ra guru ringi ma omrolel ma dibod pela maungi di blil rahawai seguidi agora gerdeblom sodel toera referral mara triple ngaringa telgiblom sodera era trust territory di dalborsay di ngara triple me
suna se for kamamal guktong krtyanga klabul gula ba yung sa medical referral part 3 hindi maray it's actually the tial continuous training ma access and more consultation agire and make sure and the other metomering. Kung nasa sa iyida global good. Yes, healthcare fund ang ariyang alil lo measure cell medical referral process. Hindi ministra health ade also elect especially a medical referral committee. And I think that is the issue tegi na mahuling italo sa atral ameset sa dungul relalsins. Ongil sa cell healthcare funding ti o the care was uli no mitra el naito ti mil southern cell blara Hawaii le la der lil mongil en direct tara yelo ulen bring er get referrals meral mo ti mentioner say gide cell imong chairwoman ma chairman ra healthcare fund ngaria tol more article delegates, more senators, mala complaints. Ang mlanya tarata magim le mitra bebirtir le toman lo tok. Mang le tara meeting lo manggela minister ahel naging ilo kapira video. Ngilum sala setya kapir sa gidel meeting lo transmer mal sabel ebong imesang emulmora bringing in more attention a healthcare fund. Tagida kapir sa gidel ilang dia dimla top del mora boy. Di mal heavy galtol ngal sel di kmadien lo sa minister ahel oba video etya di audio ringi mang actually telwa se ngosisiul complaints over years both in Taiwan lagi na mo rin sa nga Manila. Yung nga niya bibirtikal, tamalang mes mandekal before the Sager Ars Mayor, kung da sa Sildaborak questions and answers, sa el method, the south, el madorar tiyang yung bolsa betel handle. Hindi ka nga niya, chairwoman, awal magiging ako na interested, the delegates, mga senators in May, maraming hindi ka lula medical referral program. Nga lula medical referral committee. Hindi ka lula medical referral program. Masel sumag na sa other sige del MOU, may kaya del baby arrangement. If in fact, yung mula mo gina del move more sige del setting, it's better to put into legal language. Makumda sa siyamle taray gelu ule, tiyal meeting adul makadong so that both sa idra olbi la rong si, mabodore ringi with your input that set ringi once and for all and more sel so other rowi. Ang erong diso alduli sel RPPL 11-20 ang ramadi miro kuy se ngaringi ako teng ngase sel page 2 ang arsegi ng ngase as often estimated not less than every 2 years or once every 2 years. National Healthcare Financing Governing Committee and the Medical Referral Committee shall conduct a comprehensive medical audit. Referral system. The audit mo messenger will whether the referral was justified or tiraklala, whether service last mail fell within the parameters like pre-referral determination, prepare a medical referral committee, assessment of island care, lo sa agil dangarsing mungil, ang makit, ang ginatan bari ergid, magir rogoy. Hindi ka lo sa veterally cost-benefit analysis, lo mes sa gigid, lo sa udude the spend of island, kadambrang magir return ring. Kung da sa okmural to, magdaruli sa gigid, agil kalingay el method, adi internally, maso rame ang systematic way, yamakti sella RPPL 11-20 tilaw del al-olbil. Maka aktimor sa gidi, kung nasin na mong ilagil ko na channel discussion, chairwoman, malsumang kaniya ko para ati somal bring up, otherwise, para questions and answers. Di win? Okay. Madalo sa open ulang, mga niya senators, mga niya delegates, mga niya sorry, logger ikal tablol committee, wala open nila. Di mo lang ba? Delegate Solablay.
Ang sauli, chairman Madam Salator, a medical referral. Makmal understand that yung omisir ni 2 days ago, Gimler Hospital, isil CT scan ada kalurior. Mangkora, sige ako kasi fasasum da kalurior, yung makala find out ay kal sa area ali, alam media, medical referral committee makala lorula. Aureli sumdal motpok ay kal yotar rakta kalil model mo makatek te almering le other referral. Sulang chairman.
Dr. Mokolan Soman, Kora Smodisay.
O membro daklang siya pala, ikaling delegate na ukul kirat tarake.
Ale, preface nila ako. Mulgeral was the factor was in the Aurora City. Nga impact rin more medical referral system. Ular ada referti maluga makara omoritra sari so that it doesn't get worse. Aktilaw to.
O ela si di kamil tamal CT scanner gid. Kita expect travel is February till August clear repairing only to be removed in 3 months. Yung wala din kome sa sige sing mal liga di ka o ngani gid referral gire del central adal mo Hindi ka sabi referral ada di mo na CT scan. Hindi ka lang yung healthcare fund. Hindi referral ada nga ngayal wall kat makli. May ge umsin de ang makadamla diagnose na malo mga sa talaga kalau spare sige de esa ay test el loro kuno.
Idi falabe chairman Dr. Ano ko ma Dr. Kwatenga ka diak toktang. Andi ay gigil toya kadakansun tigal adat ay gigil tora augurul ay gigil tora referral ay gasi tiskana ulun amo daka sa edel tigal raktela adeng bay lumutruil mom sisi and abal ka refer ya kwadi mo kwal se ang kamera lo mra sen daka udo mra gidel improve ese program sulang.
Halik ka di ruli ato tu sige tangan sumsubele. Akum daswe en global gula ada ngun sige that translator ni hindi mo sa minister ahel. Expectation na other belar elang say minimum en gira kalungwa CT scan in order to diagnose. Anything less than that, yung markong yung influence ra medical referral program referral. So liability almora practitioners relang ang artiagi del level because expectation of blood builder niya say wala ka mga CT scan langar niya raktal nga etel mala CT scan kaul practitioner liable. Sedi also edel bypass rin lakadam langul more sa del level. Makumna sa selwa sa healthcare fund na di aling ngeri saya negotiable hindi kasi itong level. It's called the OBGYN mlatya ang aramong emiral magdidilwi ang klel. Hindi kasi ML driver expectation ML ako malara MRI. Kada nalmutal mobile nalmutal higher expectation al matamal legal liability metya. Mang akti malgor sa yidelen komadingel waseng ang ari referral lego leng de city de alawr. Say language lo say we are now legally liable akum na sa medical referral committee yang hiris body say especially ministerial ang atya langari next Senator Albo Vice President Albo Sombak Senator
kuktali mo na kari malsuma kera ang atya gidel isura akora no open na meeting chair ay suluasen dia kalula medical referral. Yang kadri orang na parte ng government miral me ikanom arara bla referral program abla Hawaii. Mara huri idrikal mesois brang otru lolbi kadam arara abla huriping. Mang dia kala lula referral program hindi kadam lam arabla girel. Isa to aragi del blaya management tamnar ungela ministry ahel. Nung ko dire kal sad mo nila sing raigel me elite tul. Ikad guk mo idir ngul mora HF. Raigel me telel. Aigel kora mondar ad dreng sa igigi aigel wase. Kora sorira adal doktang malu nur singel kora ang raigigi del blaya ng sir tigal sme mga del tileng tigal bong dengan er deklo to kora. Ngabar dire kora wal kora seguida walgo ulun nga seortir makwa di gori seguida wase ngarinya ko ramle ngal sangsel tal programa ka dugo idir tegid lor tela igal blail mora HF instead ra MOH ngora so mo understand seguida mal sum ngaringi ko mo del wase mabodoru alla chair gadam arulin mo tin klang aranglen ulti mo tin kli tegid mlamati lu ko mo igel luguk ong triar adra blul mergid wase tegid agi moro mesin moro
Chairwoman Adelbay. Come to understand the question. Was it a multi-rogir medical referral program even though in the Excel mother law? The rogir program am lara ministrahin. Ngarayem na impetus sa margong the transferring more healthcare fund. Ngarayel ko amle issues makadam transferring more healthcare fund.
Yeah, I believe historically that was done under the observation to remove biases related to financial, especially for us at MRC when we make a decision. That I remember was one of the reasons, but if there was other administrative reasons, I might not specifically know that.
Chairman Yanon de Amkamnil na sengaram le kora le ule transfer le ko.
Vice President Senator, ang okmuka mo mesal olbil, ang way back, kom le fundra medical referral program, logyo appropriation olbil, part ra budget ra Ministry of Health. Liliak gira la medical referral. Mablay nga regal blue. As far as I can remember. Among hindi ako ngek mong mil kasakla. Hindi ako luul. Hindi nga ringira ay gal budget act ra even year 2000 raktir ka rahel dan nga ringi. Hindi ako ngek mong komil gara justify ringi. Hindi nga ringi. Dim laka oger kumamuk mutiang argel luul. Kom dim le funding magiguk timilomar ma aurela medical referral program ngar evngel a ministry rahel. Ali a medical referral program al mara Philippines sa ulmura 1980s. Mong mel lang. Segida one comment ang erura comment Minister Greg ang irmang sir minister ang laringa lawyer law rolo bangkel Cindy Haro Anklet akmadang liya document langkar redil amirura guidelines ra MRP emlegire lor tobdringi logiu Administrative Procedure Act ending diak dimlakal pas ending akmloge ringil etia dimlakudang lil tokoy mga guidelines ang aringin dingkel maasam lamat. Ya minister ngirmang ada ko niya kung aring record ng India.
Well, sila initial lula medical referral committee ngara 5 das ngulang wayim ngong yim lulbil. Di masaw that indeed you're correct igal previous years ang unified budget at top da igigid line item hindi tial la de almari mak ulmak mentioner niya das global good whether kada morsel original version malubi kada mortal da ngari lang whatever it is hindi kita ro kuya gire del gut makli sa igid mak ti bring averse no mo das igel ligang al agire del mo ngila da contact tra minister lenya dire kumne signer sa gid el MOU
Chairman,
Abo.
speral di mo dalel
adang
MRP dim lagi molingit ringil mera HF dim lak tiang nilun mas kamam dim laka gimolingit ringik mo may gimawara tiang bayan mal dim la sama melngara ko kran sam
dia um das til agida may pal blatak akmal madngalil way seul makasay gariol ngel adel lukyan di ngapel ngatam bere sege maradan mokoria minister ahel del wasay le hale di boda blatak le chairman medical referral telgib el gora ngutel chairman civil already bokta agulis el macro certil at program hindi agire del dibiota tungol master adra uto gire asmer melmon melwaisay regardless ang alita to de ko all te kita orgadi tel ang arale mak appreciate ra at yemel wasen dimlakal mo laringi teding ilul maskumi okay ania ay o kome senator sabay deko
Sunod chera, kung dasa, karika ako ramle, o sisinga ka mga Vice President, mabaalway se, Chairman yano, Dr. yano, tiyang walko kaldiri kalulabol ko ra additional el burden na malsuko mong kung alung ringing, amla mo gire, dal kuk tira kalomdas sul gire, kasi kung makarang, and what would that malsum ka amot mo kala elo bangel ako appropriate funding akum da sumle o siya kari ganti kamutal ko siyang gradim lagi mo ngit ngit tamla ngul mer ka mamak la ko ra wangara o singem beringira ako selte tele la bredel le ko kumire la
Senator Malungil, sel mle dul kudang li. Ak mukom ngu, funding ay ko logi wa 10% ra alcohol and tobacco. Sa igidi. Magi diring sil di verbal magi gilingek na sa tiya ngu ngari funding lo punggil. Hindi 2021 argim ngu tiya luror, hindi mlaka funding lo punggil.
Halak po, sir. Habang delegate tara malgyo.
Tulong, Chair. Chair, ako masatyal MOU. El nadrong lela Ministry of Health, Human Service, tial Social Security. Ito yung dadome sa tamlesa na nga wa a Minister, ka Referral, a Minister Uduy, maulay tultul la former SS administrator, mga chairman, Dr. Yano. So, kung kung malakatak lang ka MOU, luwaseng medical referral or under SS. So, di ko sisiwe, ikaikital functions. Oy, makura di letal keeper huriping last year mo ko kim nor sa medical facilities and medical other lower tamalo uniform HCF kita tell mo yun bulgul asing under healthcare fund di kukura alda ora abebira members sa house ito ko rawasin ko lelungil pol separate mga ko di position all those years sige pol stand alone angkal HCF ang anamom CC anamo sa LD niya ang dirkos pera SS support ng iloyak til MOU sula chair.
Kuling ita chair Delegate Ramalgayok hali halit tagi del restructuring maybe asab edel mo next di tagi del ngar alela sent agi lo ngar alemanit sa medical referral program malgina del mga taklil yung ungil te alaleng tagi der tokta ngal ngar MRC lo banggel te ngal partra Ministry of Health mang sel البضو مسرع أمت مقلة يجل بلاي مارتيكال سمير المو أقولهم لها هيلث كير فاند هي مويجل بيبي رانغر على الملرا أوسبيتال وبيلين المو ترغادي توكتان for the most part يل سيلفير هيلث كير فاند تيجي MRP إملاس بيل streamline process update building contracts, rent, get to up to date arala all nila utilities mga rangklel mga ni sige del operational management hands on compare the Lobangela hospital lumusin di toktang di medical care. So I think we need to appreciate that luasing malgiel mo web target us pa alla laul detagi da ay kaptap atoira 1980s and may lamang der kang lulbanggel am lamo chronic situations problems of life mga
Hindi ako sa the say other minister held that the other talked about other guru. But anyway, that's a very different discussion. I appreciate ringil maningil was Egang dinungile chairman magulati sama microphone presenta Senate Bong.
Malungil odo song merga Dr. Yano malungil odo song merarubak Mal, nice to see you still involved in our medical activity. Yakmal mrenga sulem leng. Way back before you helped me a lot, you and Dr. Yano, for my son. Tial referral umodengi rangara mo ng Dr. Yano well mlakang malul. Ding let ko rahel daw ulmodengi lul mura hospital. Masel lolgit daw dul mura referral. Ento ko ra augurul mangari ungela minister rahel. Hindi mlakang luul hindi say amle understanding. Magdulul to daw el mura hospital lobangela igel roguil activity seludo el mura hospital a funding. It just recently in the change of management, el kuk tumi the way I look at it, the elise ra funding ringi, emergo yung ulmas kami ulo ko daw lo kasi como mura ira insurance mo kadma alto daw dra insurance el mura management tertial maulo kong ilo. Hindi ko kaga ko mesring abay gire del mutulutil ngun sa ministerial. Mukuktim albang ra a funding ra insurance. Ela kam nga management try kalblara a huriping. Like last ngalem le administrator ISS amora huriping el momis ay kalblay, which is ang labiyon ra a responsibility ngi. Mang kadabay o Mr. Ngir el alda adado abay do Mr. Ngir melungil edalutal mastrera a minister held malungra ngi lungra ra management. Mentoko raw daw de dil gmiyo kung daw dra di serole la a management elang ra minister held itya maldala la ministry spel kuk assign tara adra al sel lungra lay gay gidle igira Taiwan ma huiriping leng direk ngariya kan ang halek lutul di continue ngariya problem ra dial problem ding complain ra tel housing ra a huriping igiem kami amdengel wasay ke 10 rooms ela tul room ringa occupy ra tara employee ma a office which is hindi mlak laway sirang ramo esira nga niya tasya mo ringa mlaringi gelet imol kentaktel buigem mlaringi yang mo ringa tasya yang mo ringa amos yara adam ble feel was it that's how it should be ngirel nga ringa other belawol either ang nurse malubeng nga ringa ang kurang nga ringa related ringil morat kura gurul malangar sel help pertirgal patient lesera nga ringa atasya ma amos engel adra huriping narseya di driver only dimle driver engya nga ringa atasya ma amos longra arsmer mang everyday they look up to them idirek our patient tamong ilaran real leng sabil mga adura other belaw nurse malubeng other hospital mang they feel safe yung ilaran real sel suma other belaw mo elandia hindi ka other belaw ngarsay mang complain rat patient tel mura huriping hindi aksal mo touch rat Taiwan leng gura dia kamal lebadengar ngal girela Taiwan di huriping ang aringi esel kita mdengel waseng sel blara huriping at tilob daw audodra NCD fund no furniture ngi leng wayablol sel mliblidar smer mdara huriping wayablol ngora gegre ko skodal magdam lo ule kadaw sel time en dirga malpe center gidal marat Taiwan mag ul kadaw ara sel building ra huriping lagdul mdar so sen increase our patient el morsem say amle purpose mo seguk ay guk til de swek raw lel sel program el may mga paiguk ti de swek o segale lungil dolutil mutel mura eungela aos a minister ra held mulgi ongraal mulmut regel management ra building ra at Taiwan ma huriping bol adal ngara hospital ra ongraal malakam involve ngi kamil adara tegidle insurance seguk til de swek leng ako mister ngir elang ang wild san mangalam lang mo complicated real time mang kami doctor mo gol blutel por kamam dolutil egor kami mangra referral masen refer tilmong eguk tim inform ra healthcare fund model provide the funding eguk til ngar segide tabul ko kongra ra insurance at mo maungra lablay ra huriping mataywa ma Hawaii.
Chairman Magur.
Sula chere. Ukti ko swakal ko bakal mo agenda ko lang ito chere. Kadam na telegraph tripler. Mung ela time kadam na kwasing nga niya. Wala daw ilgirela either renovation or new structure. And then going back to mulukoring it chere. Kadam sa da telehealth platform. Tilang how do you foresee the future? Wasi kadam mo dia ka abel mo Hawaii. Kadi ngarai lagi nung kalau misalnya kayak gitu cost associated lo banggal saya gitu masuk kamu dah kabel kul lablar Hawaii el time tata dul kira semua kadim lamor saya gitu since December melang gua dia kabel referral mo Hawaii lagi saya kata na innovate mo annex tawra medical treatment mo electronically or telehealth services ngelanang mo dia ka mal belukul tablar Hawaii or kamu kena di elaborate saya kita telehealth program triple mengarang all together domestic sulang.
Kung nasa sila question was yung ngani since na create a platform most edel yung ngani was pala lablay. Sila may responder mo sa chairman na medical referral. Kung nasa labay mga almoklo was pala selblay.
Yeah. So there's a lot of opportunities when we think about telehealth there, because it expands our access to discuss cases along specialists there. And I guess in a way this is a step up from what was the store and forward, because store and forward is considered telehealth direct. Sometime like when they initiated it, they put all the imaging and then it would forward. But I think if you have an access, we can easily refer cases and say, for example, I have a patient I'm really worried about. I think she's a good candidate for heart surgery in your institution. Maybe this can open up more opportunities and a faster turnaround. So we see these sort of interactions, and we can even link up to another doctor that's seen sort of cases that we haven't seen. So it's the same cycle as what they had when they were started practicing, but it's also for us like the younger doctors that's growing in this in the ministry, so that we can access and get help, because we get a lot of complicated cases. So I think this is a good way also to follow up, like if we do have cases that's referred there and they come back, we can use this form also to say, I have this patient that returned, she's doing well, I have her on this sort of treatment, doc, do you think I can, based on the labs, I plan to increase meds? And it really provides a lot of assistance and helps in connecting all of us together. Yes, because there are some set of cases managed through telehealth, and there are some cases that we do recommend in person. So that is the actual, it's not something to say, it's not going to replace referral. It should not replace.
Specifically, triple continue, or how is that working?
Because we don't have that access. Yeah, we haven't. Yeah, it's a case by case. So we don't dictate whether or not it's a program that we refer to, and based on the criteria that they have, and then they say this is a good case in mortal intervention, so they'll help us send the patient.
Elbo Senator Udim, elbo floor leader, elbo talams.
Sila Chairman Corte will tasil se Dr. Yanoma, Dr. De Burma, kadang hospital. Chairman tia kadang issue la MOU ma medical referral ma HCF. Kadang sa do ang wal ko mo nganya gray area la senta gilo longa alter program. Di kukti mo do te adra blu Dr. Yanoma adra hospital la anidra adra blu la service. And zero dakar bela mo un refer more outside la Taiwan mahuriping. Number one challenge sa kumda sa mundo about facing inflation na huriping man na mas ala la rogoy. Mak tregal disakal the flagger say chairman quarter and direct mo affect la cost la health la referral. Inflation na isa apanas. Number two is domestic Ngani nga ongita sa luto na warga Dr. Mokolo ra ospital mo ra referral ma infrastructure. Ako talaga din maadra blu Dr. Chairman Quarte o mesra ako situation of the citizens of Alcel. Dito talaga 2.6 million lo laban mara Ministry of Health ng termal infrastructure hospital. I see a conflicting issue al dangar Alcel. Kung das lagi ng mga dagot makita local infrastructure, kung tim local, mesa kuk light at tel MOU, sharing ng raala, delegation of duty. Leng I got to nga medical, mga administrative. Nga kamo bang Dr. Quarte, Dr. Yano, Dr. Mo, kung may rogol talk ta, you have to protect the confidentiality ra health ra. I got private information. Ya kung dasin kita nga pa sila adal di information masadon mangi dilaat maltrolo ay gidon man siya at siya tara risk black na sira arablu was hindi ka sorry ra record til for other non medical agent mansum tumaw ra HCF bo take ra ga please nga oath and sign a waiver mal ibang siya liability clause sa tobal sa sum tolo ay tatiging ra arablu siya kung dasin mal ko urgent le kimara FIC sa kumla adra member FIC ngariya sarang ya formal game signer ngi sumagi ol oy da babir nya ada global sa tri teral wal wagi mo kolbus se ko di recommend mora HEF ma SSA ma Ministry of Health ma sembro non bol strict le ada un tomo madakt mo hospital tomo de tomo marur le tomo madakt se mo mo ida failure se tramal tap wa mo ga ada se trata five reason aul mar ada mo til mau guru lang Tiale tokora logistics ma medical referral ay gadi klaro. Akum daswe urgently umgot maklir ada dia kalgero sa tiang arge. Idim provide a service makloran dira ad man la reservation tiloran mon ma guru. nga get proper medical care level range. Kita to ura infrastructure ma. Ako to bring in our baby rata. Toktang will provide us a service. The so state set toktang like pagik lagal wala logistics matora. A furniture, a whole whole olive stock la tetrala held. Dr. Well, I think you will also agree with us in Tokara finance, to infrastructure a local hospital, to accountability a questionable issue of a contract. If they can solve the board for a podi legal contest, losin tamru ramalmat also wadra blue. A late show some learning complaints in him lambrad, a gig issue get the deal with. With that, so long chairman.
Sula Senator Udim ekwa ulium sa Florida.
Sila chairman kuktik poksera comment na kalgiret tal meeting ergit. Umda sen tablol maklol aspect ra to agrula do sa daring al sales. Ako takadam sa dra healthcare service delivery, ma healthcare service financing. Ay got two hindi kita wala blada dakta kay mo o nga asel tal imol meeting ding let kami the sel tora healthcare delivery akum da setial tokora medical referral program aw lumo lagi del one point kadam le matigar gid ma sendir ka we lack the capacity to deliver certain services raw gurul alinya outside capacity gidara al selbelaw maul mga mo end up more refer o kya patient more outside for treatment for their treatment and based on that no bidra pressure more all bill it must say gida del help other patient the referred in of island say gidang mulmu lagay gidal logya wachet appropriate wachet more cell time sa 2011 or 2010 ikadrili tagi dalla al create at healthcare fund alingam na amle mokta amle ma intent niya mo wal provide sa gidal financing mechanism ra at tokora health delivery healthcare mang ako das en gida del mal mo lalak lo mes ikal history ra ikal tokol bladrul ma trendra tele del merur tial tora a medical referral le ko mes report ra mer adra SS e kaldio mes ra dio mura 2011 el 2023 kadam la investa 28 million
di mo ra cover expense ra referral adal referral program. Es el domestra trend en ulmu ulgegrel amount dimral el 2023 na we're reaching 4 million. In terms of dollar amount, in terms of the number of patients that referred to outside. And to me, from the policy standpoint, kung da sa serya kalsa lungil, gila mo concern el gila say. Leng al sugma intention el gida builder tial belul mo sa el digid al take care patient el gida mo sa el ngania capacity el gida handle la maring luguru leng gila dam lamo mo mabingek mlasay. Tuangaral lugurul batang la lugurul ada normally the referral adal moringi trial build the capacity gid el girel say umesang ang umarak mo sa maturity ra adal refer tira o si suara tir iden cancer malibang niya ora rectala brain ma urotir di kita ada kata technician kami abai merut ay galur mengi me giri lo ay segi dek nasay med invest ra ay gigi te toktang te technology ad invest rather than pay mo ito tell do more outside edungul invest segi del capacity sa peder rulia al treat ra ada patient ra serbela o ngerung ngira dal dir kalmo mindful sira al hita covid ito mahal ba ito wala direk lo struggle ng lo diya kasi el 330 masimra for there mo diya kasi el mang way kay gidel event tagad mo mindful el girel el klaseng ada continue brutal belwad mo dependent ra hospital ay krel belaw diya ka controller gidel ngi akum daseng kada mo kade beringi sige da kami nga medical referral committee makamil nga HCF meda dakal lo mesay ka lo ure da do lasmal al come up with a policy rulia blue vela mo mas build its own capacity to handle amring lugurul while at the same time and say continue lam grower tial al finance tial guk HCF program argin el most of el di mo tawdo al sel bela lakadongoy tra 28 million el mora ay krel bela. Sige da ako diso kaldulil ko adi mal da shed el beklade da setya da kal full training it's really up to us to come together put together a policy nga mo almost misi ay del ora ka atol dam dasul el mo sa pedal good mok le da sa sige den el help gidel ko move forward chairman
sula Florida da swe Dr. Diver yang ang clemam leto del first el appointer ka presidente mo members el hospital authority el trial separate hospital memorial was el investigate del udo the improve secondary or tertiary care of below so da se seguida de ko del tara strategy skate al senator Telams
sula senator Kwate maranga suleme senator Kwate mo sabem mo dong itan meeting man Sabeda mga dudura, tirgal members sa healthcare fund ma medical referral committee. Hindi ako sa ko encourage sa uduro clear patient tirgid mo medical referral. Hindi ko misagel record ra kal medical referral in healthcare fund de kadam spend over 4 million and send other mga guru referral last year. Position time in below kada may sa complaint ra adal let's say medical referral committee ak mo kumamrail iti di mangira temir in magrule mo smer malube selbong ang wad labol salmat smer ya Dr. Yanom ne mention sel tukura magurura tripler ngam sa MOU ra dolong le minister ra held ma tripler every 2 years that Tumru sa gid le MOU girela ENT service. Hindi mo ngila Dr. Yanol magtakli sen man le purpose ra. Although magdasenda ad ma medical referral a triplet on the sure tirgel adal le toktang gide msuvel mo toktang maluwen tirgel el soldado el soril mo toktang e top te trin mo mendigel selected el rak ta gida sabril accept ngora mo sevga ngut sel el bonio ay gida el toko le adult tuiral de swir tian medical referral ma triple e umrak mo facility gida dial enough man giredel increase a room sera Hawaii mang mo saber de sender adal mo el costa gida mal gegre ludo men diabo de spendel el mora Philippines ma a Taiwan le nguegel namadum kada magla saber del improve a question a kun saber del el lola pa egal healthcare fund lo mara dagal el dossier hospital malube kadara specialist ng surgery malubeng ngarngi au tutelel de investan mutu kloludo da rablura Hawaii el increase ra arun se no se via adal do rock mortir tial el medical referma triplera amgat tal go am saudangi mendiago dangi Dr. mo kumiu como parte del JCM meeting letial program la triplera trageren mo da ourselves el JCM meeting la que vive en morir en November mendiago de kami
Senator Mansulanga kegida gel representative ra House by Bomsodi.
Ungil tiyal sa speaker kama presidenta Senate ma chairman Dr. Yano ma rest sa last meeting el giblan ngilo ngela tagi do committee ra tal hospital for state kale delegate sam langi lewon tetia ibn president ng lay Dr. Yano merenge magdamlase Ministra Tora medical referral ma Bibila toni tiagi ligera atripel metra subject pleda ni sakolo ai sa sera mera disir agimna meeting ra tiagi JCM joint committee meeting nga kom tera house speaker ang taklong tera house ako ka senator whips om tera senate magimna ngiem bring up tiagi tora atripel medical program gitiam le discuss lagi ma chairman ng mamalo chairman sa direkto kami bring up maybe ang issues sige el time doctor no gadim na meeting kung mo dong mora sa appropriate office mang material ding yula text sa alsil mang klema na so isu sa JCM meeting mag confirm mo participate sa JCM meeting mo ngi almandra 16 ma 17 number 6 no mong kumlakan for mo join sa meeting malbos sa gide sergi mala Hawaii gida mo sa tial triplera ya soldaw ma tamal willing el help o sea soldaw mal willing el help tial programmer belaw di mo yo regil go ko ay sa mortilo sengra ko spe or tigel go expert atora agrul ma mo meet the appropriate counterpart a military kalau mo maalu mo ngora ngilsan Dr. Anul Mergil was ang anyat al musul el ma benefit improve a program fingers crossed sula sa gide
Senator Makla Sois yang ada report ma'am el mora Miss Anson bigagi da summary ra triplet morning mamal mortir
sula sabemos ser egal information malgo kung ngariya sumam recommend develop ngela recommendation rakaw
tripler malungil basyor aigel long term care mang homesindringa cancer care tirgel nora guru ra tripler mam leungila guru tir mong lol makamantak lang ara tir Dia ngari nga imol maas dir ka namok tiorgi nra tripler.
O di ba o halapas ka Saudi?
Chairman Yanok, tira low spec rakal ko ra mo suka kali kadamli attend ay kal sil recent meeting arikit lubanggel presidenta. Presidenta Senate mas speaker ay kakita kami makura mo low ay say kikit SS administrator maka kami chairman ng mamarawi senmin sa inabol tira kal na sekit al kire la to ra tripler. Mangungile toktang amlutan mal mo makatakli wasya kadamal normal aswar wasit tial program ra tripler atada masegi dia di imol mal segi dia level man mo o samariar e wase maktu arungu del wase kada makarangi malmol man ngaringi lembia ka kostra medical referral why say mangungil amlutan mal mo di segi dala katoktang so lang sel mal I can meeting ari kita Dr. Quarte am sel ko tel meeting Senator Inabo, makamam na house, ang anay Tom Lail, segi del wable interest riki, aklamariyari ng riki del soad al malmol mga tripler, ang president, ulmakura dire kal ngulula na Dr. Quarte wasay, a minister ahel dah malgidel ng artiang, dire kal malungilekal information na tikal tuktang al relay mora minister, president ra Republic Belaw. Leng ngaringi auror al maray elang according al moral information in the inaralas del meeting ng Dr. Yano ya president tamlo ay salwasya na itor elang OC Carolel lo ngaringi option al wase kadmo renovate tial blay ra Hawaii or kadmo maarab isal blay lekla maria ring kita adar bela malmol malwase me matangaringi lengang tada o sisultay meng malungi lukurul way kelo ko Dr. Yanwal wase long term al daboring yang mal kut maklidal mongil mangaring audio marare el ang al kegita naito other del obistra president ma minister Rahelda malko dilang artiang ang botaka karikel wase tigirel keltar el angale at ko in mer kamamara alas del meeting al giblaringi wase anay tor el ang ako rawal scout around ay gel possible el blay either kat mo renovate tial blay ngaring el ang el tiang a raffle estimate teringi a repair adi imo ay gel unit Dr. Makol 330,000 ko raw isegi di inabong way sila ngaring so lang malsko mangkira el mo renovate ay gel tablol unit ay ko rawal tablol unit markong mongar o elon malar tama mo over $500,000 na dala. Mawat ko yung wasay, mema desal wasya bay dom Arab estel blay, ikalipo bay worth ringi rado the repair tiyang. Leng makasar atan mo ringi ma. Adi swakalo ay siringi lang wasay, bay swakalo gel wasay, wang raw riol girel segi dari lang alit ko el merkama mapula say. Anay tor elang o sigil segi del blay, manggirel submit tawal ko ra a proposal el mer matandre el alwase makarang olbira kalulay po to ol kortire lol nga seori kita lom Arab esel blay ore kat mo renovate tial blay mangkora siyang way siyang Dr. Yano malso mang kita na meeting bol sab iul dire kal ngusuka kal street update tirkal ngartiang al kongres bodo riol bekla dal kirel segi del ngia aklamaria ring kita ma ako lagi dulu hasil kata makarang yang malmol mesti aluguru medical tial tripler hospital ng Hawaii.
Sale chairwoman, ang tas yung multi tial meeting na JCM, dungwa commitment ra adra tripler ok mati ang malmol program kita dirga ngari access gid al morngi ru era dbara housing.
Senate.
Hindi ka kura di trial kadukura masado tel tukura triple teatra programe Dr. Yanol di kal spedel oiti. De tia di kal el time do so de tia gidel adu ringi tia makatagatali issue. Tia nombre kal administration agi mal so ringi teatra program di kal spedel oiti. letiadi tadal mergid. Mumbai dior gidel sumaria opportunity giredel da mi. Sel isura housing, sedial vessel toy. Dial isura housing am katatal toy. Yamle mondar say sel area angara residential area. Egida swadal hospital for medical. Matirgel ngar sel area adiakal sorira atogor hospital angara sel say. Maulang mloringa uldas lo sekdo sigra building. Iderek the trader sel utum MRR building. Lem say the lolgoringa delegate cost a lot of money. Mal sumag the spend $500,000 renovate. Amle uldas wa say might swere do arara a building. Already diungil building engara different area for medical purpose. Masaya bay tele uldas ela goren tel meeting regme kom labay continue coming up. Alas, I assure ten omregal administration, gire de los sigra esel site, elom ara building, ngara $500,000 to 600,000, because of the area. I may be wrong in it, that was discussed long time ago. Mumbai ngara lela ka, a government, los sigra area, el sepedem ara building ringi, el for tirgagi del medical patient. Ledo, omdaswari innovator say, I think we're wasting time talking about it. The hospital moitra 600,000 renovator selma. Pay might as well the builder of the building.
Maria, Dr. Yano.
Senate President ng Malmaral Tokoy, hindi ako sa adol OEK at Tripler, hindi ikagida gire yung momtingay. Temela Trust Territory, ikadruli at era at Yodur clean mong. Hindi ako daw ra approval ertir. Tadiyaw spera tier gidok mong galada benefit ra government rebelaw. El-ang indiak. El-ang toger gidok mo. Gal smer sebel mo sisiklamam mo ngil toktang malsugum tira ko ngay gidamong. Labi tokla. Maul magda mangiritik mo tiyang malamol mandiakal diakal wang aramong.
Ang way say, Dr. Yanon, with those comment, yaul mga aramong agardire kalulong da swat trigang awaya lo super gid. Trigel patient trigel borsay for them to learn how tial siktes gidan. Alway aldul wasing tam super gidling arakted isa a unique rakta. Magdaldurok rar patient gidan mom tam super gid for their knowledge. Semble isurang aramong Dr. Deber. They want to study us.
Om das tel tora triple adikal for last anamotara. Hindi odelo assemble technical issue tial website. Alubem lo de audo der tial program ndim lo de also the refer for whatever reason edi metod. Mende ode semlo de audo dar umlania technical error website dar umlania security cybersecurity issue.
Malm saurate al segi del wala healthcare fund daw liyak segi del MOU ra October 1st at 2021 yagi mlo ngo administrative controller tripler that includes single medical coordinator al ngarse ngi amlo contracted under a healthcare fund so agi ulmu wagi coordinate with Alin rega rugul mora Hawaii ra October 25 2021 magi le start dital one staff agi mle mga dudura Dr. Burnett ma Dr. Person salulingit niya access al morsel PIHCP mandiwan al staff for healthcare fund nga access ring il morse gid al website diwan al staff for healthcare fund mga dudura Alin al coordinator omrolirar adle at tripler ara rokuy healthcare fund kal spend daw dal mora ticket mara law ko morse mangal staffer kama makuktiw lo manggela Alin and make sure as well coordinated they gal referrals mora Hawaii Magi mulurir medal agim le refer medal 17 el sme era October 14 na 2022 yagi receive a email ra PIHCP lo set mo what is the word mo what temporary on hold arogul to until further notice. So agi uluger alin namli explanation aseng sel website tablel seng hacket share tamle hacker ngi possibility tel adrasina. So a Chinese nga spyware. So tamle stop ngi, and then we've been communicating with Ali na matanggal Dr. Burnett. Dr. Burnett tinggal le director a PIHCP sir kamam Ali na loldra karadal mo, and then ang morning gay Dr. Nguyen gay di APS director a PIHCP. Mailer til me asen dirakal resume del website and sometime November and gire la alin and mutul momit ng gay del director Dr. Nguyen, and then the momot adul mer kamam lo sem la mo sa bumiwil al mora APS el website el dakal sel team la website ng aramo.
Hindi tiada ada problem rablur belaw.
Regional.
Maganda sa sige dia ul mang stop ayel referral. Lengira del mo madingel obviously legal issues sa law sa Vice Chairman Rahel ma Dr. Yano gira la JCM at maral issue going forward. Hindi kum daswing kopian dra igal telureram. Hindi kum das hindi ko ngariang la government presenta senator ma speaker. El mga yes modiak tayo hindi military ng arbelaw magyolong internet opportunity to access sa legal service. Sa utara discussion. Di morse Maria another question era house.
Del under military siya del tripler. Military hospital. Oh, okay.
Kabong delegate sinsa.
Jadi weekly dogera adra program masing tiat tokora gurura Hawaii di tripler alu mangaria mutul wana hospital beside tripler mesendra a patient traveler morning.
Tripler ma Shriners. Maybe I'll have Dr. YB talk about Shriners.
Testing. Masulang ate alle nga mal ngartiang el tara medical referral committee member mal support ra continuation ra telblar Hawaii. Tiang amal makatatal issue ra housing kasi adal renovate leng alokong ngarapitar oblil makora building code nang tara time kata ulum ta sa sepay dito para apply leng one smera. This was like wherever al sarta NHI ya one smera albong this simple el thyroid ang cost tergida 20 to 30,000 malsu mang ten smera albong al direct kal casino mara breast ma awa uterus ma kidney and can go up to 60,000 mang mahal mleklowa ay impact ringil mergi deleng dekal cost ra ROP any money. So that's tripler. Direkal beside the tripler it tells Shriners agegeder al merbela every year. Ang wa Dr. Deborah Boltok tang yung Shriners sa merbela every year. Tirga sel merbela te ditir taraigel of island specialist trip support ra orthopedic surgical issues ma bone issues rangal kal 0221 tamel every year screen 1 week mal dia ka cost ringil mo ra ROP dia ka ra medical referral mo support ra airfare tir ma hotel tir ma ra pasa stipend tir esel met screen el 1 week esel lora lengar tirgel al sal kasayang 3 or 5 al-approver tir mora of island referral mora Shriners ra Hawaii. Direct kal dia ka cost to ROP. Ega gidal tablo hospital Shriners ma tripler as ko ngal ka 025 0215 en pair sel ngal smer ngal family escort mang tirigal ngal kal loray gidal lugurula malmle mlongi le tukuk ti mo siga arala akalir le apply ra medical referral angaringi ma transportation na being supported by medical referral ma again katitim sa that tripler and these Shriners atara program algire dal mal supporter ngi in fact at diri gamle ra bigini ra yir ngan nga kuk imol mira ra kasus ngan nga tul pending al cases Shriners direct kal ser albor nga covid yarogul clinic samble in person amble suspended di Shriners di mil mall mal teleconsultation even now mang assume nga ko ra case el corazón de liga el discussar ngi guduk ti email mortir etira kuk setra date egida amor se egida tele la teleconsultation direct kama so kal ngartia o sa sengmal bato ka ungil equipment sa hospital I mean covid kadam los mer people were crazy after covid nding mal multeng ala bato ko lungil equipments in terms of teleconsultation direct kalmal so kang at assuming mase whatever we do agi mal sana igel MOU mangel non medical personnel ngar hospital siri in lo bang kamalo meeting mang sana igegi dal liga confidentiality dekal sabi disclose anything outsider igegi dal medical referral committee mang again ang akmal ngartiang support through talmalmol mal supporter sa gidal housing ra Hawaii hopefully mo sa either kada marab esal blay kada renovate
Pumalmal o medic lati mo last dati will tumlam ko takliya tikal kuktok tangal git kita madingel wasa igal cases ma tripler maybe Shriners illegal special cases tira not anybody can be referred to unless igal preferred cases in my hospital klungolela hindi ka lulubela di kalharaw they get the best treatment as well makabay kiri-kiri lang amora tiyatukura kuk domesa numbers more or less at Taiwan sir after COVID kada mal sa number mal example which can understand was yung mlaring close chances na numbers ma open as kogima kita maka oget algelos ela sales kuma medical referral committee al present case mo ngi kami approve ngi sel model sil mora HCF mo ko tira ako kuma ang sel parte tira to payment ma arrangement raw gurul ma ala tiagi dager selbol of island adal mo gurul emergoy gel el feedback ata price of gurul ma whatever treatment that tiram now receive I get him al mat mo bisa HF any of those information are they shared with the atigal physicians el tiram na refer a patient out if nothing ako kumbralo sinagiril mo mti kasi gida ko to tell ko mo meros are you sharing the information at the HCF lo mantrira? I get tial ngel toktang al ngam na refer patient or ang tial medical referral committee or kung di maintained for financial record di ka sharing the knomti gani chairman quarteling mama mla oles el direct knomti lo selgi mo ngo do ma toktang mama belaw di mlaksel communication til mom de kwasing aging nga stage raw guru that time and I think it's important although na dekal nga other HCF that's the cap I think we should look into was magara improve cell communication ang global gula asmer nga guru adirekal intact nga contact ro ngel gukle local doctor lo is a progress guru mora kwasing wa nga nga maybe civil recommend ako kwasing ra what's the next step to take.
Well, kung nasa mal global goal ngaria ada doktor tarum ade kalolo ko di sa mungklir manangi. Tiriga nga information or baby ras me baby tira relative city Webila di al relatives til di tao ni akpay ma email til merga lo ay sa isir al webinars me. So talk about confidentiality. Hindi that's how so I think chairwoman health medical referral I get patient information. I'm sorry. Hindi kasi ulit ko. I get the tol mo raw udo mabiling ang alalit tirigay. Hindi ngalsmer for example. So, ma-referring physician ang smell ngulo talaga clear kami. Ang nga aliw mong return ringil mer nga di albort tirigay. Ngal smell, ti algurur smell. Although da more tirigay, kung da sa bring niya floor leader was entablol to awana healthcare financing, awana service. Ti al service ada al siguro mas tirigay. I think that's what umulgor niya delegate Sinsa. Kung microphone sa President.
Hindi katagura malmlo mo kategatal masyador tial housing matagura triple Dr. Yano ding ladia kang artial dia kadudul wasedo sigra blay mangapay di ekita sira abol issue blay rahuriping yagidim le mitra president mga saw nga kama speaker ma Minister of Finance, decide lo sek dom arablay. El base recommendation ra Minister hospital sel time. Magumda sur elang hindi up to us, el decide. Ya speaker am la kong el wasa gibora supplemental budget, en sebed lot podia 600,000 arablay. Now it's up to the gel adalo sigra blay ra Hawaii. Alabang kita girel lor adi askel blay ra Hawaii. Bang tao mo sperenge delegate kanay lo sigra blay. Oh, okay mo. Ngeki kita naitol president tamla makarangli bere Dr. Yano en bora alam nga mas speaker lobanggela chairman Rahel dra Senate ma House marterul chairman ra Ways and Means sa president egoril wasi apply mo sigringing wangarang wangaratletelel emergoy adabora supplemental budget el alberage ya speaker ako ngel ay ka emergency immediate lel sumagim la top da 5 million el upgrade til hospital regid le kada madeng lochen marse doctor mogol en la gired el direct el health per se gidel atara issue kada ngara housing doctor Yano sel housing ra Taiwan seklo complain el girel mangdire lo uspe angesura a doctor senator Cuarte ma Vigi leng aigil complain ng Taiwan al mel girel sel blayer at telela room sa mabenjora al sel material smell kakaru saraktir crowded ra imol room siya issue at Taiwan ekaduguk mura huriping doctor Yano maguger kaul wase selul dasul wase doluti tial management ra logistics ra huriping el mura under ra minister a health adang dir ka somul continue lo ra laigel blara huriping len elado mesya referral aguk ngara referral bru rang ra referral magumi ngara insurance guk bru rang ra insurance eda sigia management guk mongra la blara huriping lakam mongra la insurance guk pomosada apply luangkal melomregal administrator SS gongra ra SS tianga ora ala diakal alway disela millions of dollars engo sa aras kogil mora huriping mo o surber ti alblay masauder ti alblay ya insurance gida direct atale SS direct malus pe anges administrator mo kamatangailing ker direct roder ama kukmongol sa sela udo se di sokal ngol de sur el albay de development tirar delegate bar senator se lel sumang somil continue waise agi erem waise mo somil chancellor ngi agi mga adu ra president el girel ngara lela leadership ra senate ma house mga adu ra president el girel ay gidal baklaw tutrel el gida albangala
Sulang President sa Senate mlari nga krim Senator Umi edim nakal answer ni mong cost amle increase double lagi mlo ngara medical referral kami program mamle double HEF limited administrative cost ngil di 10% ndakal girel lang lak masay gidra gim ngaigel cost ngil ngalak ra 10 mo dagim compliant ra lam mararinga so mamal loluti lagi di oi di tirgalada de halom correct muntaharaw di sorira service di tigide presidente Senate obora take care obora calvos esel obang ngaringa obesitir say ngaringa imol toktang lingel toktang o mesa rigot sarsmer musindir tira di ngal gerdir obis lol tau tiger rogui logspe ang kalsmer mang calvos insurance ngaringa calvos office ngira St. Luke's longra rarsmer ablirir mal borngi mamlirir marogoy madbaram rigel mangwaisay ngaria housing tira tele hospital Good Samaritan ng Los Angeles ma take care mangwaisay mutiadakal dalib tokoy aigal insurance company ungra rarsmer tiray gay diakal bli mulguk government tragwam ungra rarsmer ya insurance lo ungra raw guru ndit mak ndi sel ngaringia issue management and sabel luldakal imol tokoy aluba kadmingi misel de binging mobtoka miscommunication makulkor niya kung somil streamline lekadam lartiang kom mo komskida meret mo ndiakal hel da haraw grul bol kumia haraw tial ralaw grul munglo ay saygid munglo dia ka balsela kalment elan somil lo tringi mangidi pa mo dengek mo sugo mong komoluti eng mo diakal mo arablay eng mo diakal mo aramlay eng kumiaw ul dimlakal kamam
Hindi ako maulang soma maulda swiuling alsuman somil continue agim erem waisay.
Dakal somam, mal dakal somam. Kamam al dilur kamam mukom la rodling kal ngal ka. Malakal dil kladol emro ko malutringi.
Mang alsumang waiseng bulgulat tinge mo siya alsum kada separate tinge agi fund ringi.
Yes.
Okay, may lagi mo understand ringi malsuma gi ro dalir gumiu agi moy taw do dal girel. Ngidi adi do si ringi ngidil bolungil aurior. Mar adal lo spera service gumiu bolungil. Ya kama direct mal betor kama usper til at service mo dal spamel gora moy gumiu ringi. Sulang doktor ya.
President Rastenet, kami pa itulutulogel wasay. Ang omongra aring ngungil, oral bora MOH sa ngungil. Mang segi di akikirel karyolar kami uleng mangita out segi di akikirel karyolar saya sola President Senate magmaman mom dangali.
Ere somil decider ngin somil kama decider ngin.
Actually, tel budget talaga tilob lamle decision alwaseng lamu tel mora MOH. Lekom tingila ba funding al malmas 3 rowy. Yes.
Oh.
Kahalelo, so the chairman always and means le tial we need fight budget along with sa dilwa sa udo deho.
Tiak nalek poras mo dice audo ta mlora ministera health di ministera health sab el kulaseng taang mga tmokler tiang malsugo mag-create rin al sel hospital eng maudo dra HCF I mean NCD fund mura medical referral program al malor hospital al sumang waseng mura NHI eng mau ay geludo dal mal mura NHI make sure ay expenses na medical referral program are paid. So it's up to him. Minister Health ay geludo dam loringi enya sab el waseng a medical referral program at tilaral taong ora aringi. So it's up to him. Hindi kal Minister Health ang alel.
Malungil yung ngani tilay del intention. Di sila bara reality. Emblol mo ngoso. Sabi el articulator nga director. Kada ling kada koto mesra tel repatriation or other sila mat. Healthcare fund prepare ngi expect la hospital reimburse ling gyang ngani sila trust fund. Oo. Ding it never happens. Lingguk ko toira availability raw do dama. Ang toira availability raw do. Manghal dim lab sa minister ta last na meeting ko malwasi. Sabi iwal lasa invoice al may. Di nga aksel bagume sa igel ko albangalela ministry and priorities loro yak crash fall dilwat yang. E kami amo last. Le already na paid.
Okay, let me explain intention na Allah sir lo ngot mo kani Elvira kalulal wasing mo help for repatriation na remains. Mali NHI ada kang ngalela remains lang ka namo dakal sir. Namo remains ngalela family. Mam na intention na Allah al create trust fund a family ringgel at hirel pay. Hindi kal government hirel pay. Mang ila ngartial waseng lamang lang ka kapalmenteng maasarang ma'am landia ka dim lakal intention na ma'am lasing at trust fund natin lo help pra family girel el per remains are adrit so mal maklaw do dra kamaldi lamang maasarang ma'am sel obdur ka ma'am lasing ay ngasong sa do dra at trust fund
halektal din sir say so a repatriation ng aada mosmera let's say Taiwan. And then ito spe angya sura ripatra adrirel may mataas kara HCF alwasay mahara ringi malme ya family reimburse. So HCF ako he de haraw lengar nga funding atil biyot el pay. So they pay esel leme ya nga adala hospital leng referral committee la hospital me referringi malme badenge leng mor hospital. Ya hospital adya kal pay ba kartial repatriation. Giran mga rira family, ya family per hospital, ya hospital reimburse ra HCF. So that's how it is now. Nding say gidan more reimbursement tel mera HCF adya. Selbol request ta funding ra family mo pay and kal pay ma hospital di mga takkartial plans.
Ali sel la amal clear. Sel ngel sumang ngari amos mera Taiwan malube horiping. They have to sign the why say se ngaring audo del give them appropriate the law arngi se revolving fund mandi kal girel til al moso isbra al sel say mela sel sumang ada mosmera Taiwan engel adalongra arngi saing esel lemay esel gamaldi la girel in the first place and pay it back el morse revolving fund man continue le segi molto audo del girir al six al adalmat al suma siksel ada dikyul madara Taiwan en gabera siksel ad mandia ki modelo sa kum lagaraya insurance ako asoy sa para sirtiang
sir alkot transfer tial MRP may gil nga MRP mlo ka medical coordinator Taiwan ma huriping tigel ulmasel mo mesra report ta gimle contractor bebirar abel gimlong song saraim magimle arnyawan ra the mam already to save cost ta gimle transferring in mora Taiwan alwal girel ngegi dia coordinate tagal medical referral al morse alwal local logistics el part ringi mel asay gidra say April ra I think nga report 2022 ya Minister Referral ang ulingit ra then former administrator alwasing nga yawan ramlam mosme nga Taiwan ospe anges wewal ko ramring ler ma'am a coordinator tial repatriation ra badenge lasme almutel merbelaw since so already established nga ya admi nga say mo takang take care ngi mo merbelaw family members will reimburse ra hospital kama magibos kami auto tertial revolving trust fund.
Okay, kada na mo understand tilaan, di tilay sel domes ngi en problem ra minister ahead der elang.
Why
Leng nasi sebiu rat ko dia kang aliur ngi.
say gid and ting tika ngamla mo ospe angya so immediately nda kal sa edal kay montar ato long let and ititrir bala kal sales mi auto to nga badeng la adal merbelaw. So we just did that. Tesal me gim la asker tira se mo takangal mo hospital mo kita receipts mo taludo dal mo hospital en peringi.
El tilay gid gitang adia kal ngar aliu. Malsuma minister asker may dulo sa minister ndiak ngar lem leseng ari revolving fund ngi ngari ngila minister mengyang kirel longra ngi mendiak lagi lu accept tatol dia kal ngar liu elang minister amlo aigel suar elang ago meseng la mo so isra al seltal management terbiar ego mo seng a minister mengmla otak lemir murad lebed ekom continue murad lebed meng memem dura minister lo setia dia kang lamer ngi kami aku tinggal lia insurance semberko besel burgi elan spiul besel burg mama to dia kal spiul mura minister yang ngela minister yali direktor finance se ngari revolving fund ngi mela question o se tirgel adal namadar adril dirka kal harau
correction to date and the one na dirka kalpol pero hospital mal sabihin mo saludo dal may mas kamam everybody else amla gim lang ursel revolving fund
may lang ngari nga udo ursel revolving fund
kiral ngari
el tela 6 times 5 adori minus 6
about that much 24
6 times 10? Yeah? Ngoy say, 6,000 na imolat. Anyway, kada kuk na mo so iso se, Dr. Senator Cuartemo subese kada gora mo interesting le kada mitter tirgal mal kada samrial mga dodor tilender stara talbuil da kasweso.
Dia das presidenta senate global goal one ragel ataragel en ara agenda gits el discussion starus tel medical audit ya das tel ayid ya dia el part tayid rogil discussion el wasing kada magara ya Manuel wase Dr. Yano I hope in the future a healthcare fund dating area Dr. Yanor. But as an insurance company, basically funding rin ang ngod by law kita mala tax mo support rin ang talgibal ngod adal rule al morar other ablu unlike nga healthcare fund nga private medical insurance. Kung da si sige dia ngar aled make sure kada protect aigal asset lulia kala kada mamalay lulu dira adrablu ma ako lito was at some point chairman of medical referral committee ma administrator ebo do mes sige del medical audit was ngar agel parameters el bod measure every 2 years al issues ra patient care malumeng issues ra gayid malumeng tiagid issue of return ngari atara time ko mong dasura sen lamo time ela kada available ngara political wind the lim regular audit mbodo ngali outcome ra red policy driven audit ako lingit lo sa sige dia abodro ulen ya please respond le amle eldo lo bangela a prior administrator o say el to din kay Dr. Yanol was simla mo sa saudo madbo sig mal sumingiya dal auto del al ruling boss el regular
Namsale chairman tukultur kita ku aisra kami kamar atar ulbil was el time kamam order lo Banggala Asia Development Bank Agi overall momot mokra actuary study. Giri la HCF. The work is going on. The matter of timing. Sabela ADB, likim na approaches there, and they are willing to support the HCF. Giri la sige the consultancy report. Sulang.
Sila sige del since kung na MESCA support sige del RPPL 11-20 direct na esclo se kabo mesa sel feasibility study ra coverage ra hemodialysis catastrophe cases manso mga extra premium gira other mo pay ngwa extra coverage hindi kal parte sige del lab sabi mo lo kyare federally. Okay. Chairman Mangor.
Coming in sel was last till garige makuk tioge rastaru sa MRP going through the MOU kami malblatak was in medical services include the MRP in the transfer HF committee mo kami sige ta ora kami local medical referral program le ko mesra MOU o mesra actual la me creating sa MRP creation la committee Tell mo yung na transfer MRP la ko kami sige na agad.
Dr. Yano, remember still last meeting kita kung sa chairman na refer mo sige dal well ko ram ni request ka mamali ko kami ura HCF. Samlar say hidan dia.
Agari ka wasa tel medical referral program mumla mor kami walu bentir na le MOU kami di wasa hindi ka lindir kung dir ko bang mga sa medical services ang MOU say included the MRP
akum daswe delegate ang magiriul mo clear mutiang mor either way in swamal over and the elal fiscal year akmla olingitra governing committee natirgal rutra program akmla say al suguma la local way say gid in the next 6 months, you will transfer responsibility to mora MHHS. Giri mo clear. Yakal ka ma'am.
Clearly was a medical committee created by law Rasil Mohammed Slapten 7. Mga 5 members ng create a medical program. Kami ako clear ako lira HI. Musel mo mesra mo oyur kami agar el wasa robatak la MRP ngarger el time sige da ko robatak. Mga doge ko sentao ngara la medical referral program. Le mo oyur kami abla takal wasa all of island medical services. Agari ko si sing include the medical referral program. Maluman dia.
Igel Waise, Igel Alaha, of course, tel Blal nga Manila, Klalra, Poklela, Klol Amt. And Igel Bashol where we can list, Igel list Rablay, Taiwan, ma Gagidele, Mlay, Rahuriping, Igel nga under ang Klela, HCF, mabang account Taiwan, mabang account Ahuriping, mga ang Klela HCF account. So, yes, the program is under.
Okay, sige dagel was kami am namo ngara asme a medical program o el tiamal blagatak specify amlay mara ma abang account mara ma medical services sige da mga doge ko sa medical program ngara dir nga tirim la mor kami
Dr. Adalbay tial MRP ang algiw oy Papa mamang Papa a Minister of Health tial committee hindi akal logi gumel bol committee hindi committee ngi mengi amle transfer committee ngi ali sedal all bill mirtabil MRP hindi ngi ruli ma members mendingi
hindi ang malblak takala kasi committee created by law The medical referral program created by the committee, which was created by law. Masira do sadar MOU rubim na MOU langara medical referral housing ma program of island ul bangala MRPL uban dir ngarti.
Mabangela HF. Referral.
Aboy.
Since October 2021.
Kamo Vice President Senate
Chairman, ako mo sa tegi dala amne ulil al dadu kadilu kwase. Lo mo si kala evya kala al create tel medical program. Dingare medical committee masaygi dia gel wase. Matiang mlongara ngara igel mlongal sang selra hospital ko idil lego ngalube kami amilar ngi hospital ngi lul mes kami. Amokte wase. Bodot ngel wase gi del wal blen ngal sang sel. Alsum sa PL ngar hospital, edungul mo hospital ng gilal nga rin.
Senator, medlutul mo 2021, President Tabaes el President, hindi ka Minister Rahel del Tarrak. Ang kamring laptulur rablur belaw, emsaw dra medical referral Ministry Rahel. Mungul mas kamam, mungutiang ngura ima. Siyam lewul. Mungkaram le girel di temporary moringa minister. Hindi mo nakal mo yun.
Hindi ako mahal ko dala manmilo sa men alblal por nga minister kung nga ba ito mas segi dadlu tungul mo ungal garangal ka. Sulang.
Vice President sa Senate kung naswe apapaw lumes ra kirkal madu lo karurangal kamatingil masterir. Mpay kila dal mal appreciator kami e olingit talo sem memolo mga kakuksegi daw daswek. Komul mo orang.
Hale po orium sa sola blay ada dul girelse.
Chulang chairman nga kamal di follow up siya el garil chairman kamam rawation min sa House of Delegates. Mga ako masatel MOU yung execute June 7, 2022. Mlamang mereka tara ka madarangil. Ya blay ra Hawaii imol ke kanil blay mga ra oles ma kung sa Taiwan. Amin ako di ping. Ko ramal mering la askel amot makil la ikang mlamot tara ke ko ra katmok. Ikang ngal gilel gutmok lo ay sara olbira ko lang bolo kin bas el mredel. Smigay gil kuk tetelel amo rumulay kal mo ila sum nda ka udo papam lang ung kalngal lo dalil mer kamiu elang gaduf na mo ada dul girel sulang
Andi ako Senator Corte hindi ako aktiwa siya ulo mang kadosel hindi ako sibela sa almas alom kururang alang giret sa almar dil maul kada
Hindi ako sa chairman ra medical referral committee chairman ra healthcare fund. Yes, kada mga asulel healthcare fund no sil absorb yung responsibility ra management ra gid. Ang sa tial administrative management apply funding may gid problem ra as far as I'm concerned. Ako ko niya sa tial medical service adi kalsi uling maimomiringi. I'm sorry if the minister sang. Of course, it's mamitar waldo hital was a emergency. Ngal adam lamad Maria revolving fund la amade and then we cannot do our job relegating our baby ra. Nguk Maria tateidora. I'm sorry ko mo raise ang regay. Di ba tam ko Maria tateidora kan aled. I know you're not comment korabent telekor community. Somehow held that girl why say. Anyway, komsulal mrulay gandi at some point we do need to comprehensively modong as a nation and to figure out what is best for us. Makulingit telwase Dr. Yano al minister kafar but adadul girel sel blar Hawaii ebo do no okla di tibir mal sumtal ngal ka giren malo der gor miu ebol clear luasen ngara omrod ngara giren ngarsei the I will die tomorrow. I will never agree luaset ministra hilda transfer ngar yarsme el morangidi el adra blur belo any sector. That's why ngaria ministry rahel. Either that and ngara role do ruling. Kung microphone sa Senator Mangsaw.
Sula chairman kung dasan direct kalungil te alle chairman na HCF akbal aplada igalko effort sa kamiul sira last year April 2022 lo so lo ngas isel coverage ra cancer medical care mo og with the line ngam malo nga sulul kadam dengel waseng mal bring la arala tel tretara gurulo being on the same token akbal dengel larming sa cancer patients waseng mo ring time exceed tel amount patokora bloolo siga to asen dakal sa loan and dakal sa el ko mo ring agreement agi willing al haraw ding wal the otra gay gidal ko la ma regulations sa bangal mo ko diswa ka bring up bring impulse el nga consideration ra committee asisil time kada direct kilomeseng kom direct kalmla extend tel medivac air ambulance el service el direct nga ngaramo ng tuk titirgel nga yaw dudir asab aril nga skogi logordi transport tra nga ligir mar baby retirel mar outside malt bermudo lo mas ta report tra mil wasen na moringil available da dil bora imol blue ta extend el mora ba igal kmeder gida huri ping ma Taiwan ma I believe sel gotang tripler TMC ko mal masawra igay mal bay more say gidal ko rahmal alarming malumong wal ko ramo suwa karong udringil el surveil milgat mokle tiawa se ASTHO stat hemodialysis and diabetes TA for Palau tiawa migit pa-clear siya summer 2021 el malblaktak kalwa siya olbi lawal lengitra away tiay gidal lomusub kuha oblem report tul mora tisera wa 2022 last year July Mr. Chairman na kwarte tiasel domes rin di stat trabab o aisel waseng close population are adult about 22% 3,115 na smera raktal sukal akbal remember Chairman Quartel kamle blool lo maklat kirgida adra bulul waset yal tokora NCD a National Health Emergency el gired el takal ringil el all time di kadongil mokluko makadamal barangudul wasen kanya insurance rigid el sob clear gay gid rakt dik direct el lolingit msel boringit gid el audit e direct el bodak nakara gay gid el rakt luul makadamo gired el mo access ay gay gid el mal takay gid talo sa hemodialysis $834 while per treatment imol patient mukakara o kail telal $80,000 $36 mang akum daseng balolingit sa igidel ko mo understanding rigid rokoy maungil commitment ma let's put our heads together do meselo se arangal gedel maral may tirakat maral di teenage mos vokal matastatal masil mang kadom daswa away kay gidel tokora dilngar elementary malubang high school alubang tiagi ako la direction so ada lo mestringi alubang sabay del bay el altam kada takal tel issue o siga igel kuk preventive methods i.e. kadam dengel was a part of tel insurance program rigid agar gi sel sabay del el mora check up akum daseng kasar gida avail sa gid service direct ka dos per tel tel chairman kulgit tambom BEC sa gid was a seng wangarat tel el makarada access ringi es edel morger kung dasan direct kalmong sugi the ma other vela rokul kabangatal time. Sula, Mr. Chairman.
Sula, Senator Mangsaw. Maria Ngoto. Marisol Malukon. Kabong.
Dr. Quarteng, Chair, hindi nakakurang ara agenda, hindi speaker, if I may, yung kora te lamal ng artiang atara house mal alvilungil kim race at tel kora miscellaneous alvilungil. Ang may kulangit Dr. Yano, kakita SS administrator ng artiang ngora a committee ra held ra a house ako ra malmring ang loriol kirel sel el bill el kukngar kamam sel blet ada do ringi ra lamo ikan lamo mereka el sil sa mabuil marak so lang mang ngora malswa ka reng sa ngarem kaul administrator ra SS madirek el Dr. Yanol nga mal do spering ilway kelol ko Dr. Quartel wase kadamral ko rabi melulu o langit el wase bol sa Dr. Yanol li remain nga rawa HCF leng kadamalo spering melbol sa iul ko rabi ako osper kami iul ko rabi i-update ra tirkal delegate sa ngatiang puto ngin wase ko ra ngaray kel ko ra malmle amin ko ra amle karmamle ko kami ngara ko ra mal lulduswi ul girel segi del ngia abodol tobra HCF ra al sela SS mal sukum ngora di wil busule Dr. Quarte presenta Senate mar senator se edungutel te ale dren steril leng BS administration ra SS kora amal sel domeseng tamlamonia building at tir makapacity tiram lamo agyomes selwase tamal na upgraded HCF ay kiumra lo sa kitang mal taramal efficient al karir di le mal highly educated al amal sa el lo ngseora a governing board ra HCF ngulamos sa biir el ditir el lamo kiril el tuwa dal mo kan ngara SS lekin umra lo sa SS atarak mal clo el ngara al the responsible el kiril makumra lo sa administrator mal el direk lumbral way kama ngara house el wase mlamo time el kida dolom dasura aku ka kora olto tir kuk mo di liak la el mo sabi el ditir mangkora mal so ila lang artiang nga dilungil if I may the chairman Quarte the presidente alam el lo ay sirkida igel kukora mal ngar al selarandir kibom tu raw rera me ki kuk mo sin mora senate ki mo lingit tir man el bol lo koramo o kongres segi del nya urung la house of the house sulang chair Quarte
kamam sulang Madam Chair kal HCF umodangan wasam na mo more than 10 years and as you know arokul to ko isel Loral mong yung mo start al complex mo to ka ngar alil as you know MRP for example akumdas yung LL time with the management now and the governing committee HCF sa building lorior ilingaring ya complexity ra APSL issues coming up sa building gilal address. So my suggestion yes, I think Girela HCF will graduate to assume its own operation, authority. So lang.
So lang, Madam Chair. Sera lomo October tial health insurance program ra other belaw. Ang dimla ka infrastructure. Magdamlo tuy ra SS lang ngaringiya dongurtir ra o malaylo daw ma omi ma lo ara clear beklat. Magdamlo giw say gidel infrastructure ra SS emerkong odakyar tial tokara HCF. Malmol malmo lamo true madringir rak 12 years lang agim lom tigringik mo governing committee al baby lang mo kakbos al doswirtir ma bordra SS mo dagim rule of ram lang ngaring ya mandara dolong ngagi del SSA ngara dolong lel mo daglo nek bungkang SSA ang administrator HCF al-UP and administrator tial SS administration. Amraringi ingkang a member ra HCF. Direct member ra SSA board. mang segidel para role ang kal administrator mong MA amo ruli mong mo bebilen dakal blagatak lalu mo dagi mo dek mong loyalty ringin more lagi om dasok na sengungil al boliliak tial HCF mangari board ringil gukti mga dura gukti administrator retir len sabak lamamra bebi rol giblabti kung moringa manday sabel kitang sabel technical issue sabel o indirect sabel o liu direct sabel hindi mo kakaringa at talgibel support magyong ngita kami kung mesang support ringi
medically Dr. Yanol was tiga da other house lang artya cell collection part ringing kung direct mero ringi alubeng cell remain lo manggela SS manditial administrative function amro da lansum
gyol ngitra SSA malakal dil itamaman mal tira collection emro dil forward ay gel gukmara gitang bukul bara gitang
nasa stela idabla tak lewa taut tiga idadaw do Lawrence bang halip sa telela chairman Inabuel bara president ada mo samal follow up
Dr. Yano, semle issue in the beginning. Sira da gotel create ISS, el bornya insurance, el dulum da sursegi del collection. E direct el self time india a management el separate ngi. Di el alblal borngi, e na busbe del separate na management leng na moringa adal spe longra ngi. Masi amra lungil luldaso mang kerdi separate ngi. Management tamoy liak leng na moringa adal spell manager ngi ya collection adi dolngi tra SS mong collector ngi di make sure kang maududil mister resell time mong every quarter maududil mister elak mo rega del kuk mo sois para tra quarter
President ra Senate halek kwala di hindi SS amalar segi del seng 20% SS administrator still administrative cost siyang dati kal sakal dio ay stringi ma kata mo madengel wasim tingkat mo maruring hindi mo tata well anyway wadim na sakal bring it up bang tamo madengel delegates mar senators so wase segi dati kal korawal ngaring ya aral tial lureri del marular tial toy
Sulang Dr. Yano mang ay gahidal issue ra collection I'm sure in sabil contract ra collection service kung nga MOU malubing agreement tal covering adri kaltara amle so mal kura ngol da sul girela sel mo invest tay kal ludo ma ako ra dire kalmle kim momdas seringi awaseng ang sapela COFA Board of Trustees di imo nga ra investment ra auto ra governing board man di kalbol necessary kami wal alguk mo marura investment policy aguk mo o masubaro lale investment aguk mo o expert ra dealing with consultants ma awarding ra ay gagidale investment fund management murak muntang mang sige dati kalmlet tara kura question or man sab iwal kura discuss ngi and maybe dire kalbol sa edon makauting lasing how best the board amo sa longora arigel investment fund ra ay gagdele NHI governing board makti soal law ay sir saygid ya questioner nga ge girel sel RPPL 11-20 marong tial reporter kami wa ang aring sayhid alblel iwi senator mangsaw eu ay mula sa hemodialysis ra 55 al patient 4.4 million na aral ra tara mang sel last liner sel page 4 at report na kami kung mo ay masya a total cost tegal 443 el laamo el tira sa ilmo malaya hemodialysis ang ana 35.4 million unsustainable el dekal sa ila NHI coverage el mo ugut makli el in-house mang sel RPPL 11-20 requirement tangi awase mang ngara recommendation ngara how do we nganya kura sa ruli I guess this is a national issue wal kita al decide ak mula siya kad makarata handle ni leng dal nga himlara hospital selbli la ara adal misil ka dire kalmal hindi kal sal mal lungi lal murar adal al smera asukal kita tinggal lo sette di maral te report kami dire kalwaseng 22% tara atabela wa al-adal ta asukal or etam usukal or etam tamlamo sukal manggiril bato ka a health issues at tira gir motrungi mang ahi okay ra lang giral nga niya conclusions takal sa pedal di oitik tiya nga ma sige tiya pugerangi letel laagi a request talwasing makada makarang hindi kan sa pedal tiya karang sulangi sige tiya ko ra question nga
Alek ko adiduli sele ko sa semal lo de understand del wase la dia medical insurance that would accept or dia maningil wase di tida problem minister aquí la ministra Helda de Algartia mang unfair el question el gimol ko ni ding ngaral maybe a healthcare fund that el fund that el treatment but can they fund somebody morule ya access ra imaleme at suma minister Helda de Alsel ngwa cardiovascular adalo cardir belaw ko Dr. Robert tanang mo de Alsel mura imalaat tadi way segi del momat sabela de al pete rogi lugul it's gonna bankrupt itself hindi ngaria portion na yel at least mo niya access at galat because right now other elang de Alsel morgue ngaria other elang ngara permanently gagi dele yel IV ay kagi maikli. May la question na mga kasi yung gira drogira ministerya health was ma-access ra imalaad. You're talking about 16,000. Mga riyar other velar elan dito ang klase, well, we might as well just die. In fact, ang riyar other na decide. The question na siya sumang ngariya portion ra healthcare fund na nesitero gil treatment. Are there portions that at least we can address? But other accesses through law. Other than that, ang girela Ministry of Health provide the access, especially cardiovascular, every 6 months. El mervelaw, remula imoriti gala, so the pura list together. Ngaria list, I know of about 15 na lang. They cannot go anywhere. Tiduli seguide Dr. Yano lang. Understand the was in the also there's no way a healthcare fund assume the hemodialysis. I know that for sure. Is there a portion that they can actually address? We can only address that also kung service in Mervelaw. Because in the surgeon ng Mervelaw early. So I hope it's a clarifier as a Kaboy, halil, bo Dr. Yan eh.
That's all. To respond sa mara Dr. Cuarte, Allah amal bilqtak mlasindia ka udodra HF betwad mom omsad maul aluben support raugru hemodialysis makli option akla se masel 10% ra alcohol and tobacco ngaria excess amount ringi asibil authorizing ngi magdaw sparing it tilay kidil dak malodra la kundi msa access mo magdaw spare sel do cover it tilay kidil okay say give the response possible solution ekadmora ako comment ma question Senator Rubay a report vehicle report nga magidulungit tik mukamot dia honest opinion asto say give the opinion tindim nagi mo comment ringi madim nagi duk tilang luid lour nguk madim letir agidim le provide the information and di dia kalau ay sukna se hemodialysis ang aringi a prevention ma post condition post treatment post condition matigida girulam da surungi other olbil prevention sabael المرار هذا السوغال السوغال أولى تمام kita gidnir tira lo betahay bla ngaringi akar and then they are available ra formulary hospital emring la aral among so mi authorized ra HF ma medical NHI mal cover agel الغار تيرقال سوغال او بريفنتيف تير من داخل المريض المو را كدني فيل من سبيل ماريا قار مرين الارال السوغم كوم كونيت مثل هذا بورغي سيجي ترى solution سيجي option number 1 number 2 a hemodialysis a chronic treatment الجوك مرين الارال transplant Miwa miskida te alra HF cover ra imol transplant ra 1 year. So mi the top ra hemodialysis el tara solution tial la authorize ra renal transplant el boringia subel el boringia bungrang tel kiren. Avoid ra hemodialysis mukom miski the alternative. Mayrang ariya sam mulkoy.
I just, I do want to re-emphasize on the prevention part, because when we think about, you save more just by prioritizing prevention, and then when we talk about the common causes of we're looking at dialysis, we know sugal, high blood, or if it can be high uric acid. So if we think about it, it's combination of what we're exposed to. And maybe the next step is to think about, there's a lot of things in play like social economics for our patients. Maybe these are some of the risk factors, and Doc Tang has a really good point, because as we give chronic treatment and medications, they will be costly and they need frequent care. So these are all things that we should really put into place. And I think since I have the mic, we do want to say that from the medical referral committee standpoint, we really see increasing number of cases, not necessarily hemodialysis, but other chronic conditions. Like we see the trends of cancers are increasing. So I did look at some of the statistics or the number, the types of patients we're referring off island, and we're seeing this trend. An example is in 2021 to 2022, majority of the cases I saw the tumor sites was related to gynecological cancers. And when we further dissected based on the reports that they brought back, we saw that it was ranking number 1, we saw it was endometrial, uterine cancer, and these are related to obesity, lack of physical activity, and lifestyle. So, we have to think about what can we do to really, prevent ourselves from getting sick as well. So that's one of the roles that we do as the MRC, which Jack Laubesel mentioned. We do look at some information. We do give the, feedback to our ministry and say, this is based on the needs. We need to develop sort of like these services on island, or the request for specialists del MEIE. And I have to be honest, I think the challenge that we do see is when we ask for specialists in May, we do get a delay because, frankly speaking, we might not have the money. I want to bring doctors here, but we don't have the funding to bring them in. So I wanted to say big thanks also to Healthcare Fund because they helped us with the ortho team that's visiting. So it's a lot of things that we need to talk, and this is a good chance to bring this up as well.
Wala kwa ulam sa Senator Presidente Senate Dick Tulway say direct akmo itaru chairwoman le last quarter Minister Health return ang $1.4 million. So it's really either I don't know numbers or I'm confused. Anyway, kabog Presidente Senate.
Hindi nga awala akmalgoy ay kangar aliw. Mamrulaw reliwe yalang sila udo de molgol merkmam. Le lagi asker mil brulo rore como wase nginamal magram mama maldi provide udo de mama dital senator quarteto tang. E mama dia mama ngar alama funding. Way lagi del molgoy al sumo como ngar prevention e mrulaw reliwe prevention en sila udo e molgol merkmam magimol to da udo. Dindi al spa amrula il alurore megi molto da udo. Maktulngit bay recommend el may il washe gagi da may gagi da soma amrula bas kama udo. Asia spa amruli.
Coming president. Adik sa tele la Dr. Dever the nerortia yung number fodori. Comment to put you on the spot Dr. Dever. Hindi ko na sinse bring a closer and nerortia discussion gidre lang. So let me say in English, adan sa maktul torbelo. Why say? No, I sent you a inquiry. El Girel send nomination or Almora Hospital Authority. We also sent you the law. Then tela time and dom da solo send namo Girel el Duray mesay malakalkol. The separate so that the Minister of Health concentrate prevention. That's the purpose of that law. Maktio Gergal was given a young Maral do Swim Girel Tay del Toy because until direct Maria Cora divorce, then a Minister of Health Amal Masang el Patsa Yayidele other hospital oitia tora diabetes el Tayide Awul Madam Sada hemodialysis.
Sula, Mr. Chairman. First, I guess this wasn't the venue to have a discussion about primary prevention and secondary and tertiary care prevention. But I mean, it's really an upstream problem of preventing the diabetes in the first place. So we don't get to discussions like this of who's going to pay for the renal disease, the chronic renal disease that's developed because of the diabetes. Dr. Yano brings up a very important point about there are certain medicines that will delay the process. Okay, that's important. And there's also the issue of if we have the opportunity to have kidney transplants. That's all well and good. But the point is that it's the primary prevention of preventing people from coming down with diabetes in the first place. And as much as we talk, we're not doing a very good job. And I might add, I don't think anybody else is either, okay, in the Pacific. So we can beat ourselves up. But the point is, whatever it is, we're not doing an effective job. And we need to go younger and younger into the community to really begin the issue of how do we prevent diabetes. Right now, we have a very effective, I think, school health program, which is identifying that at least 1/3 of our children are either overweight or obese. These are the candidates for diabetes in the near future. And it's guaranteed that it says 22% of the population. Well, if you go down into the pediatric population, it's at least 1/3 of the population that eventually may be at risk. It doesn't mean they're guaranteed to get diabetes, but this is where it starts. And we haven't really put the emphasis down in the pediatric age group to really deal with primary prevention. You know, dealing with adults is difficult. That's why I'm so glad I'm a pediatrician, because adults don't pay any attention to you anyway, okay? And it's really hard to, we have interventions to stop smoking. We have interventions to deal with alcohol. We don't have very good interventions in dealing with addiction to food. Although there are some real efforts, I know Dr. Yano probably could go on about the efforts that he's been associated with, and Pearl Muramoto and others, in trying to develop programs that will, address diabetes in a primary prevention way, and then also deal with the issues of secondary prevention. But the fact is, we're doing a very bad job, okay? But I might add, just so we don't beat ourselves up, there aren't too many countries that are doing a better job than Palau, okay? So that's where it is, and I've been, appointed or nominated for the Hospital Authority Board, but I clearly have one foot in public health, and we just have to put our money where our problem is, okay? And where we're dealing with trying to figure out how we're going to afford, the 22% over time, and it's going to cost us $4.4 million for 55 patients and $35 million for 443 patients. I mean, we can go insane doing that, okay, and trying to figure out how the money is. We also have to be talking about the upstream issue of how to prevent diabetes in the first place. That's where one of the places we need to be. And then since I have the microphone, currently we have 20 patients in Taiwan. 14 of those patients, as it was pointed out by Dr. McCall this morning, 70% are there because of cancer. All right, and soon it may be that all of our patients going to Taiwan, will have cancer. I mean, really, and there's a logjam in Taiwan with housing and acceptance by the hospitals, primarily because of the 14 cases that we have in place. They take about an average of 6 months apiece, okay, for various regimens of cancer therapy before they're deemed cured or before they unfortunately expire. So, things are slowing down because of all these cancer cases. And I mean, there are some solutions to that which we've been discussing for years, but we haven't been able to somehow grasp. And one of those is developing our own follow-up cancer treatment programs here in Palau in conjunction with the various hospitals. And that might cut down not only on the cost, but on the human suffering of people actually being in either Manila or Taiwan or even Tripler, dealing with the cancer issues. So that's one. And the other is there was some discussion about telehealth and telemedicine. We have many different programs going on within the Republic of Palau dealing with those issues. But it's one little program here and one individual, an individual over here. Dr. Yano has been doing this for years with his personal contacts of dealing with telehealth issues. There is no telehealth policy for the Republic of Palau. And until that happens, I think we're going to have this ad hoc kind of approach to telehealth when we really need a comprehensive program. Sorry to go on, Mr. Chairman.
Thank you.
Do I have more time?
No, you don't have any more time. Sulang, I think that brought the issue that which is not in the agenda, but as we talk about medical referral, I think we need to recognize that we need to address the other side. It is now 5 o'clock, so let me first give an opportunity to the speaker to see what to say something, and then the President of the Senate, and then I give you the chance to say your closing statement.
Chairman, thank you. Dr. Yano, madungin ano ma'am ng tiang Mr. Cambior at ospital. Di ako nga guru din di ko maklaro mo sa kung ng tiang. Ay ga di bulo ko Presidenta Senate di namugire del almost every 4 months, 5 months. Tigal member the Kora tigil advice ra kara. Ay gal health issues di para mounting ra below. Komsulan may.
Hindi ang Dr. Yanoma, Dr. Deberma, Dr. Mugol, Dr. Besirama, Dr. Adelbay, magamil mlara healthcare, medical referral, magamil roguya, akti mabantirar senator se emal mering asuliw yung malklol education na oblam ngal mas kamam. Mang ay ka direct responsibility regidel mga mokla patang ide tirakla at tingirar toktang mandiak mo dosa do ay ka hindi kung mangi gidar other bela uspe ang esura beklut silser giredel di ka plat klela gida moy taigal giredel mga mokla akmal di mering asuliw rogo doktor magolen kom robturas ko gi abela maltal malla medical ngimang di kay gidaktong marko.
Skate alle Chairwoman Dr. Maria Adelbay Fraser Mando do closing statement ako gira la medical referral.
Again, I just want to say thank you everybody for, this is such a very meaningful discussion, and our hearts are always with our patients, and thanks everyone for being so patient with us, because I know sometimes we meet every Monday, we call everybody, we bother them during clinics, because it's, if we call the doctors, if we call patients, it's really because of the, the interest is how do we get, everybody that chance, and how do we, we talk about health equity, like, we have patients that needs to be referred off island, but then there's always that thing that we think about is, they can't go because they have other issues. They have things like there's not enough space and housing. So how do we improve on that? So I hope we can continue. I got a discussion Sergit. And yeah, thank you. And we look forward to improving. I've noted all of our homeworks. I've noted all of our recommendations. And I really want to say thank you, all of you, because this is definitely something that we want to look for in ourselves for improvement. So thank you.
Sulang, paska te alle Chairman Dr. Yanong do closing statement.
Sulang Chair, era the clean this all the ogera two question para closing. Cell report ragitang ngaram damiu ngaringa page 2. Page 2, commercial NHI contributions versus expense. Sige el graph, ang area imol malamaw ma imol pakarakardo. Sel malamaw ay gel revenue gid sira lo multial program al merela. Sel expense sel pakarakardo. Lombo ra 211 and me 223. Momeseng segid ra lombo ra 211 and me lang sel pagkakata dingar eungela blue. El arrak ang koltang gitang se meral to asen malamaw ang aryo ra red. Bulgulak la se expenses gid am lang lak ra revenue gid. Revenue gid 2.5% ra employer contribution. Akti point out, hindi ako sa the solution. Akti o ay sa commute mo aligid am lamor say. Ongerong hindi swakal man mo plakatak lo gerar senators mar other all bill el mo kabo pagkatakli ang aralel a ministry ra held der belaw el mo ngarnya imal el tuov der krel belaw el mo masaw daw grul el dakal ngar belaw segida sak oboblag tak ringik mong ngar lela ministry ra held el imal at tuov ra belaw el mo masaw daw grul ra imol other belaw ngara outside the belaw mong bol clear mo gibom dur ma mo gimara last tirgal wagi tangak mo please mo olngitra other olbil mo lut man mo click mo ngal gumlam rod lagi obang alu bagyo di mora mama papa sulang
Ale dalway se agote ti chairman yano na sule ma kami mar other healthcare fund nilay ma medical referral committee sulal me speaker sulal rogul ma de rogul delegates rogul senators sa ti pagpatakil wase bias regida de alior sengargir your yes efficiency direct your cell cora moral campas sergi del cuadra hel del wase ragil agil ngara karen sergi del de algire del ku ti beo tergi del ko ma akunda sa sergi de milsao del al tergi mo blak tak on team bot sabela adra olbi e di gulingit administrator lo wase yes ngara separation ngara undasu en di seguir del auditor del ilmo o regular el program regid malngaringia ora elistan objective el recommendation el méthode de dialogue discussion malaga del political wins baru tukti SLA de guida bodrur tel waisi masea ontila tial meeting hopefully seguida mo outcome tial meeting magidi mo musagil korawa el bullet l'outcome tenga mo sel le gorgomi mo de lo sitial discussion mo logir el ge o mo nga sulu et tial meeting gida di mertia mo close